Hi, my name is Dr. Rajadnan Ahmed and I'm a psychiatrist working in UK. And I'm making this series of videos where I'm tackling some of the most commonly asked questions which you may encounter in an NHS job interview. This is particularly for the benefit of IMGs who may not have seen these questions before. Remember, I'm not trying to give you any model answers. I'm just trying to explain the concept behind this question and what is the panel trying to establish. Every individual is different and every job description is different. You need to just listen to me and make up your own answers and answer these questions in your own way and be natural in an interview setting. Another common question which we have faced in NHS job interview is that the panel may ask you what is the difference between an audit and research. Although this looks very simple question, but you need to really understand the concept, the basic understanding of the concept behind an audit and research. So very simple way to answer is that simply you can say audit is when we are comparing our current practices against set guidelines and coming up with some recommendation and quality improvement. And research is where we are actually creating new knowledge. So we are actually analyzing or conducting some studies where ultimately new knowledge or new understanding of certain things have been created. So following this question, they may ask you certain supplementary questions. For example, they might ask you, what is your understanding of clinical audit? So I've already made a video on that, but very simply speaking, clinical audit is when you identify a problem with your service or your practice. You compare yourself with set standards, and then you analyze that if you are following those set standards or you're falling short of it, then you make some recommendation and changes, and then following that you re-audit and see if the quality has been improved, and that will complete an audit cycle. The panel may also be interested in your understanding of research. So why research is important? Why do we actually read about research? Why do we do critical appraisal? Because that is also a part of training in NHS, that doctors are trained to critically appraise research. If you're going for an academic job which has an academic component to it, the panel may be expecting you to have basic understanding of some research methods of how research is conducted, so you can actually read through that, read the hierarchy of research and how certain methods of research are conducted. But if it's just a clinical job, even then the panel may be interested in knowing your understanding of research, of why research is important, and why do we actually expect doctor to be able to critically analyze studies. So when we are working in clinical setting, we are constantly told that new evidence is emerging for certain conditions or certain medications. So for example, pharmaceutical reps might approach you, or you may read about in medical literature that certain new drugs are coming or new studies have been done on certain aspect of illness. So as clinicians and doctors, it is expected of us to have basic understanding of research methods. So we should be able to assess the quality of evidence. We should be able to assess which studies have been done and how strong were those studies. And we should be able to assess that medication or that therapy which is upcoming or which is being given to us, presented to us from different forums. So in summary, when you're going for an NHS job interview, you should be able to explain the difference between research and audit, and you should also be able to explain in simple what is a clinical audit and how it is done, and also what is the clinical research and what is the importance of clinical research. Even if you are not involved in clinical research, why you should be able to have understanding of how to critically appraise the research and how is that going to help you in your clinical practice. I hope this was useful, and in the next video I will tackle another question. Thank you very much for listening to me.